Hi, my name is Dr. Alejandro Pruitt. I hope I have the opportunity to take care of you and your family. You will receive outstanding and expert level care. I also speak fluent Spanish, so if si prefieres, puedo hablarlo en español. Gracias. Well, my medical background began in 1984. I was in the military in upstate New York and started going to school and thought I wanted to go into nursing and decided that's not really what I wanted. I always wanted to be a doctor, just didn't have the discipline. So started going to school while I was active duty, went to school full-time, and from there I went to, 4 years later I was on my way to medical school. Went to medical school at the military medical school in Bethesda, Maryland. So I was in uniform while I was in class, and that was of course 4 years. And after graduating there, I was assigned to San Antonio, where I did my residency and my fellowship training in gastroenterology. So 6 years after medical school, I finished my training and was offered a position teaching. And so I taught military physicians for the next 7 years up until 2006, when I left the military after 17 plus years of active duty. Stayed as a reservist to finish my 20 years, and then joined Gastroenterology Consultants at that time. So I've been with the practice about 11 years. At Gastroenterology Consultants of San Antonio, we offer a full service GI practice. So many times, if you have a complicated medical issue, you'll end up going, for example, to a university or being referred to a regional medical center. We have expert level of care so that there really is no problem in gastroenterology that myself or one of my partners can't handle. So we do both routine procedures such as upper endoscopy and colonoscopy. We have advanced procedures here to include endoscopic ultrasound, endoscopic mucosal resection, which involves the removal of superficial tumors, esophageal cancers, gastric cancers, and so forth. And then we have a full service physiology lab where we study patients with esophageal reflux, with swallowing disorders. So again, we're a full service operation. So one of my my real special interests in gastroenterology is advanced endoscopic procedures. And so I work very closely, particularly with the Methodist Hospital here in the Medical Center, which is a tertiary care hospital. And so I do a lot of pancreatic and biliary work. I help patients both with the diagnosis as well as some of the management issues that we deal with when we have cancers of the esophagus, stomach, colon, etc. So for example, if you can't eat, you can't get food to go past a tumor, then I help you with those kinds of issues in terms of alleviating patient suffering and helping people improve their quality of their life while they're continuing to get treatment by their surgeon or their oncologist. At GCSA, we focus very much on quality care. That is sort of our mantra. We want patients to feel relaxed when they come see us. They want to feel that we are having a very personal relationship with them, that we have a vested interest in their health. When you come to see me at Gastroenterology Consultants, you will always see me. We don't have any physician extenders in our practice, and that is by design. We think that we offer expert level care, and it's very hard to replace the level of training that we have had with someone with much less training. So the physician-patient relationship is very important to me. I want patients to trust me, to know that they're going to get expert level care when they come to see me. I think I'm a pretty compassionate and empathetic person. I don't have a whole lot of free time, so for me, medicine is my ministry, and I really approach patients in that fashion. When appropriate, I introduce my faith. When I know that probably it wouldn't be well received, I sort of avoid that, but in general, I do believe I'm doing something much greater than just practicing medicine.